unit. So with that, I will hand over the floor to Sarah, who will be talking to us about her work on campaigning for clean air and healthy lungs. Thank you, Sarah.
Thank you very much, Gary. And hi, everyone. It's absolutely lovely to be here. A real privilege to speak to you today. I think I'm going to try to share my screen and we will go from there. Can you see that?
Yeah,
lovely.
Good.
Let's just see if I can get it. Lovely. Okay, so as I say, it's a real pleasure to join you this morning. Thank you for having me. Before I kick off, just a word about Asthma UK and the British Lung Foundation. The two charities merged at the beginning of 2020. The idea being very much let's create a stronger force to champion lung health and to present ourselves as absolutely the nation's lung charity. Of course, COVID hit a couple of months afterwards. So whilst we are very much one charity, the team has been incredibly busy supporting people with lung conditions through the pandemic. Demand on services has been, as you would imagine, very, very high, and not least the disruption to respiratory services as well. So we are one charity. We don't always look like one charity, but we will take steps to rectify that. And I have been in post as Chief Exec for 6 months. So this gives you a sense of what I wanted to cover today, but really my brief is to tell you what our supporters and beneficiaries think and want. And one of the key messages I want to get across is how much our supporters care about clean air and how it's such a priority for the organisation, because people are telling us they want it to be, and it has surprised me. I knew it was a big deal, and I had some interest and connection at Cancer Research UK, but I have been, I suppose, blown away by the enthusiasm, the momentum, the energy of so many of our supporters, beneficiaries, members of the public who are contacting us because they are worried about clean air. They want lung health to be championed. So I will give you a sense of what we are doing and what many of our, I suppose, partners are doing over the course of the next few minutes. But I wanted to start by painting a picture of lung health across the UK, and it is a sobering one. Many of these stats I'm sure you will be familiar with, but I have found joining, and particularly from a big national cancer charity, and I'd spent time in government writing national cancer strategies and so on over the last 15 years or so, that lung health, lung disease gets relatively little attention. So lung diseases are the third biggest killer after cancer and heart disease, but you wouldn't know it based on how much attention lung health gets and how much investment in research and so on there is. We know that millions of people have or living with a current diagnosis of a lung condition. Millions more are likely to be underdiagnosed. And this was it's been a big surprise to me, actually. In cancer, the sort of dominant narrative over the last decade or so has been early diagnosis saves lives, and we've been striving towards that as a community. But once you get a cancer diagnosis, and it can be a battle, but it's often pretty definitive and you're on a pathway. It differs for so many people with a lung condition. They really struggle to get an accurate diagnosis. It can take them many years. And that causes problems, and there is a link with air pollution and the clean air agenda here, because so many people, I think, in our population feel slightly embarrassed by their condition, or there is still great stigma attached to having a lung disease. And that is something, as a charity and as a community, I do think we need to tackle if we're to drive the kind of transformation that we want to see. We know that versus other parts of Europe, other European countries, our outcomes are poor, and they have barely improved, or they've barely shifted over the last decade or so. And there clearly is a very big inequality angle here. So you are twice as likely to suffer from lung disease, a lung condition, if you live in one of the poorest parts of the country versus the most affluent. So there's an issue of social justice. But as I say, this has a very clear link for me to how some of our campaigners and activists and people in our community behave, because there is stigma, and we have a cohort of people who perhaps haven't felt quite as confident about demanding cleaner air because they know it will help their lung condition, and we want to shift that. We're very interested in supporting lung health across the life course. You know, that means absolutely focusing on prevention, and having a big priority focus on air pollution, both indoor and outdoor. We do rather a lot around occupational exposure. Of course, tobacco control remains an issue, protecting people from both tobacco, but also second-hand smoke exposure, particularly for younger people. We, through our advice and support and helplines and so on, give a lot of information to people about how to manage their lung condition, and information about air pollution forms a key part of that. We also do a lot of work to encourage and support early and accurate diagnosis, and help people keep well. And we have one of our USPs we pride ourselves on, and that's not to say we're perfect, we aren't, and we need to get better at reaching every part of our community, but we do get a lot of beneficiary insights. So we have around 200 Breathe Easy support groups all over the UK, and we've actually got one international group now, partly on account of the pandemic, because so many of our groups went digital, which is brilliant, absolutely brilliant. But so you've got people rooted in communities coming together, supporting one another with our input and guidance to live with a lung disease, and as part of that, air pollution, air quality is a really key tenet of the conversation. And as I say, I have been quite surprised. So I've been doing the rounds virtually. I've met our lay advisory panels, different patient panels in every part of the UK, lots of Breathe Easy groups online. And it has taken me by surprise just how much they care about air quality, even if for some of them, quite frankly, it's too late to help them. But they feel with a passion that we need to do more in this area to help others and to protect the most vulnerable in society. So toxic air, as we all know, is a health emergency, and part of our job, and Gary touched on this in his introduction, is to translate research evidence into language and campaigns that people understand, that are accessible, that they can get on board with. And I've tried to, I suppose, encapsulate the easiest way we find to talk about lung health and air pollution, and that's to say, you know, that we know that toxic air is causing new health conditions, worsening existing ones, and particularly it's problematic for the most vulnerable in society. And we talk a lot about young people, but also older vulnerable people. We talk a lot about it being an invisible threat, and if people could see the air pollution and toxic air around them, they may take it more seriously or feel quite differently about it. And if I move on to the next slide, we published a report in February of this year called The Invisible Threat, where we tried to bring to life the fact that this isn't something that's just a central London problem, or it's not something that's just a problem in, you know, certain parts of Manchester or Birmingham. Many millions of people across the country are affected day to day in ways that they can't help. So as one example, we mapped PM 2.5 levels across across England, and looked at them versus WHO recommended limits, and we found that over 3,000 medical centres, GP surgeries were situated in areas of very high levels of air pollution that contravene WHO standards. Over a quarter of schools, over a fifth of care homes, and really made the point that, look, toxic air is a problem for everyone, but it particularly, as we know, affects some of the most vulnerable groups in society. And, you know, though my children might not like this, they don't have a choice about whether to go to school. You know, they have to be there. You know, we have to access public services, and so millions and millions of people are being put at risk of breathing, or are breathing, toxic air on account of current air pollution levels. This really resonated, and I think it's because it sort of brought it to life in quite an easily understandable way to members of the public. And what we're trying to do is raise awareness of exactly this, that it's an invisible threat, and that this is something we should all care about, not just you know, small groups of people. For example, people with asthma who we know it's you know, air pollution can be particularly problematic for. Ella's case has shone a spotlight on the issue as well. You know, in the last 6 months, I've probably had more conversations with family, friends, people in my community about Ella's case. I do happen to live in South East London, not far from the South Circular, but nevertheless, the powerful nature of Ella's case and the seismic moment of air pollution cited on death certificate again helps to bring this to life in an understandable way, in a very human way. I mean, the very powerful campaigning and the courage of Ella's mother and family helps. So what do our supporters say? And I think this is key. As I say, people care about this enormously, and we regularly go out and talk to thousands of our beneficiaries. We survey and audit them and speak to them day in, day out. The vast majority tell us that air pollution affects their lives and well-being, and over half of people with asthma tell us that it triggers their condition. People tell us air pollution makes them feel trapped in their homes. It triggers flare-ups, not just of asthma, of COPD, other conditions, and many believe it's left them to be hospitalised. It worsens their mental health, reduces their ability to socialise and access treatment. It's also a barrier to them being part of the solution. So many of our beneficiaries tell us they would like to walk more and cycle more, but they feel trapped in their homes. They're anxious about leaving at certain times of day. And this is powerful testimony, and we need to find a way to keep sharing this with policymakers and others. Lockdown was big because so many people, it was a wake-up call, I think, for many, and they've reflected back to us that many people saw an improvement to their condition during the first lockdown. They really experienced in a pretty dramatic way air quality improvement. And a strong majority want more information and government action. And I do feel very personally, passionately about this. You know, people say things like, well, we really understand pollen counts now and UV updates. And particularly if you're living with a lung condition, you want quite localized, personalized information that gives you some sense of power back. Because actually there are things that people can do in their everyday lives. Of course, we need national government action, but people want to be equipped with good, accessible, localized, personal information that can help them campaign in their local areas, but also make choices in their everyday lives. We are building a network of campaigners. We've got over 1,000 people locally campaigning for us. We've got clean air heroes. We've got a huge amount of enthusiasm amongst our beneficiary group. And again, this is an example. Leah, who is mother to a 7-year-old with severe asthma, living in Birmingham, and she's been campaigning with us. It's a very difficult story, and it has well, similarities you can't help but think with Ella's case, and I think that's what's sort of terrifying Leah. Lucy has been hospitalised 15 times with her asthma, and Leah is convinced that air pollution is playing a part. So what we're trying to do is bring to life real and human stories of how air pollution is impacting people, particularly with a lung condition, but more broadly as well. I wanted to touch on this point, and really how we bring to life air pollution, air quality, lung health through a health lens. I know from previous experience and sort of 20 odd years of campaigning and policy work, to drive really concrete change on health policy, you have to, within government, get issues taken seriously by health departments, by health ministers, by health agencies. And I think for too long, air quality has been in the bucket of environment and DEFRA and not taken, of course it should be, but it should similarly be taken seriously by health policymakers. It reminds me, and I'm sure I've said this to Stephen Holgate and one or two others, I worked on alcohol for a few years, and it was always a barrier in the Department of Health and other health agencies that too often alcohol was seen through a Home Office and an antisocial behaviour lens. So there was lots of policy work thinking about it from that perspective. I didn't think it was taken seriously enough from a health perspective, and I think air quality, there is a similarity there. So we have a job to do as a community to really hammer home the health impacts and the need for health departments, but other organisations in this sphere to care and to take action. And I think the coroner in the case of Ella Kissy-Deborah has hugely helped, because there is a very clear recommendation that from a health professional training perspective, from a government perspective, we need to both equip health professionals to have better conversations with people about air quality, but also make health information much more accessible to the general public. I've probably said this to one or two people on this call. Air pollution and lung health reminds me of tobacco control in the early 2000s, in the sense that there is so much energy and momentum and enthusiasm, and it feels as though there's a collection of forces coming together that we need to capitalise on as campaigners. So there are opportunities, I would say, at sort of international or supranational, national, regional and local level for us to make change and make the case for measures. And with the COP happening later in the year, that's an example where what we are saying to Number 10 and to DEFRA and to the Department of Health is, and quite frankly anyone who listen, is we need political courage, but this is an opportunity for the UK to lead the world, and we can set out a bold vision around clean air. We can bring in bolder clean air laws, as well as all the other measures that we know will make a difference. Sometimes you need political courage, you need leadership, you need an act of political will, and everything flows from that. And I've seen that time and again in other policy areas, and it's one of the conversations we are trying to have, at least with senior figures in government at the moment. I think the building back from COVID agenda is also another opportunity alongside levelling up. So there's a huge amount of rhetoric about, let's change things for the better as we build back from COVID. And I know central government is talking an awful lot about the levelling up agenda. We have been in regular conversation with Neil O'Brien, the member of Parliament and government advisor leading this work, and we have said very plainly, you won't level up unless you tackle health, and you won't level up unless you tackle lung health in particular. People have a right to breathe clean air, and at the moment this issue disproportionately and very severely affects poorer communities. So please bake that into policy proposals that you are taking forward. As I say, public support is critical. I mean, it is absolutely critical, and I've always believed that you need different groups of people working together, but that nothing is as powerful as local people in communities telling their elected elected representatives, what they care about, what matters to them, and campaigning for change. So what we are trying to do at the moment is very much support, encourage, galvanise that kind of action. And as I say, we've got over 1,000 campaigners at the moment. We have plans over the next few years to rapidly ramp up that number of campaigners. And we don't have to do it by ourselves. There's lots of community groups. I've got some very active groups where I am in South London who aren't happy with the status quo. We've been busy leading up to and through devolved local and mayoral elections. So absolutely, the point is, this isn't just for national government, or it isn't just for any one part of government. We need a step change in how seriously air pollution and lung health is considered by decision makers, and you can do that at all levels. So what we did in advance of mayoral elections and devolved elections is encouraged candidates to sign pledges saying that they would take lung health seriously, and would be supportive of various policies and measures, for example, clean air zones in different city areas. Scotland currently sort of leading the way in committing to meet WHO standards. Positive noises coming out of Wales, but sort of slower progress than we would like. And the drum that we are banging at the moment in England is, or with the Westminster government, is that the Environment Bill is a good opportunity to think very seriously about bolder clean air measures. And then, as I say, partnering with local people is absolutely key. So you will see pictured Jess and Janet. They are two of our clean air heroes in Manchester. They have been monitoring air pollution levels around their school. They are brilliant with media and on social media with the help of their parents, featured on Newsround and so on. And they are bringing to life some of these issues in a fantastic way, and showing how much they care about the air they breathe in their local community. And it's really interesting. This is very personal to me, but I'm in South London, Southeast London. There is currently a local debate raging about a low traffic neighbourhood, which was brought in under guise of COVID measures, and there's consultation running at the moment. What's interesting is some of the community are very anti, but not because they don't care about clean air, because they don't think the configuration is quite right, or their campaigning mantra at the moment is clean air for all, not just the roads that have been closed. So what's so interesting I'm finding is to see this energy at local level, and I think the nature of the debate is changing. It's much more a debate about how we achieve clean air, how we improve lung health, rather than is this an issue that we should care about at all. We can't do this alone. We do an awful lot in partnership, and that's very, very important to us. So the Task Force for Lung Health, some of you will know about this. It's a multi-partner collaboration which sets a blueprint for how to transform every area and element of lung health over the next few years. As Gary said up front, I'm co-chairing the National Respiratory Delivery Board at NHS England. That's a first, because for the first time NHS England has prioritised respiratory and lung health in the long-term plan. So there's lots to be positive about, and we know that working in coalition is, again, fantastic. It's harder for decision makers to say no if you can demonstrate there's a consensus and that there is broad support for a range of different policy measures. And we have been doing what we can to raise this issue in the media. There is this confluence of factors coming together. We've had a number of hooks, our own research. Partly our job as a health charity is to take the research and the evidence that you are generating and to bring that to life for people. And that's what we've been trying to do over the past few months, and will continue to do so. So, that's the crux of what I wanted to say. In conclusion, and to summarise the key messages, We are absolutely adamant that there is a moment in time now in the wake of COVID, building back better, levelling up, with an environment bill in Parliament in the wake of Ella's case and the ruling by the coroner, with the COP coming, with huge interest amongst the public. There is a moment, there is demand for change, and we need to translate that into action with governments and other agencies. Clean air is critical to building back better. I adamantly believe that, and there are opportunities for us to learn and adapt from the COVID-19 response, and we must harness the positive behaviour changes now and embed them in policy for longer term change. It is going to require some political courage and a leap of faith, because some of this is hard, but I think if there's a collective force of people, nationally, regionally, locally, we can make a real and lasting change. Thank you for having me, and very happy to take any comments or questions.
Thank you, Sarah, very much indeed.